Okay, so this section is going to be on leaky gut and inflammation and why those two things are important to address in our lifestyle. So, kind of the whole point of the program, right? So, in this program, we're going to go through a series of bodily systems. We're going to go from the gut to liver to circulation to brain or hormones, and then into like a maintenance phase. So, digestion is first in this progression because the gut controls absorption of nutrients, creation of a lot of hormones, a lot of different brain chemicals, transfers chemicals into the bloodstream, absorbs our nutrients into the bloodstream. It has the vast majority of our immune system in there, and it allows us to excrete things. Obviously, going to the bathroom is how we get rid of a lot of toxins and a lot of just byproducts that the system's over with. Then we're going to move into the liver because that is another area where excretion happens. Most of your blood flow goes from your digestive tract straight to the liver. So anything that is like getting through your gut gets into the liver and gets it bogged down as well. We're going to go into the many things that the liver controls, but we always had a joke on our board exams where it was, if you don't know the answer, just circle liver because you're probably correct. The liver is in charge of way more than just detoxification. It helps balance our hormones, our blood sugar, cholesterol, stores a lot of our nutrients for us. So we really want those two systems to be optimized first. A lot of times once we get the gut, like our digestion part working, and then our liver, our excretion part working, a lot of the other areas of our complaints and our symptoms will kind of resolve themselves. If we still have hormone things to deal with after we clean up the liver, then we will be doing that later on. But a lot of times the liver is so involved in hormone balance that, we don't even have to get to hormone balance. The liver sometimes will just do that part for us. We also will be going through circulation. Blood flow is required for every organ in our body. We're going to go over the importance of iron and nitric oxide and blood pressure control, and how that contributes to longevity, how that contributes to our digestion, our hormones, again, energy-wise, how you feel. Circulation is a huge part of that. And then, like I said, if we still have any brain balance or hormone balance things left after we address those systems, then we can get into, balancing the adrenals or thyroid or male and female hormones, or any brain neurotransmitter support or sleep support, those types of things. Adrenal fatigue is like a huge word that's thrown a lot around in the functional medicine world, but really the root cause of a lot of adrenal fatigue is lack of circulation, inappropriate detox, being bogged down by chemicals, not absorbing our protein or just not eating enough protein, imbalanced blood sugar, lack of quality sleep, right? So we could just slap everybody on an adrenal support product right off the get-go and you'd feel a little bit better, but that's not really addressing the root cause, which is the whole point of this program. Then when we get into the maintenance phase, we can just talk about like long-term dietary needs. A lot of this is going to be based on your genetics findings, where we'll determine, okay, are you a high-carb person, a low-carb person? What supplements maybe do you need to take long-term? What exercise is appropriate for your body goals or your athletic goals. So that's what we get into in the maintenance phase. All right, so 3 stages of disease progression. So a lot of times, phase 1 is inflamed and leaky gut. This increases histamine and adrenaline. Histamine and adrenaline are very, very strong chemicals in the body. They tend to trump everything else. Like adrenaline trumps most things because if you need to, run out of your house when it's on fire, your body's not going to really be thinking about a whole lot else. So when these two chemicals are way too high, it does make other body systems suffer because we can't do things like balance our hormones when we're in a high adrenaline state. Which can lead us into phase 2, which is where we have energy and sleep problems because our stress hormones are too high, like cortisol, and then it depletes our melatonin, so we're not getting enough rest. We end up with chronic fatigue. Then moving into stage 3, then it starts to affect, our male and female hormone balance. So that's why, again, in this program, we're addressing inflammation and leaky gut first, and then that a lot of times heals these other two phases because it is the root cause of a lot of these other two phases. I'd say like most people come into me with some type of hormone complaint, but most of the time it's not that your reproductive system is not working. It's just that it is not getting what it needs because the other gut and liver systems are bogged down. So first off is, what is inflammation, right? Because this is a word that gets thrown around frequently. By definition, inflammation is a tissue that is producing heat, redness, swelling, pain, and then eventually loss of function from some type of injury, right? What most people notice is pain. Some people will notice swelling. It's easy to notice these things when we have an instantaneous injury, like if we fall off our bike and we scrape our elbow, you notice all 5 of these things very quickly. When we don't notice it is happening inside of our gut because you can't see it. You know, there's not as many of the proprioceptors where you necessarily feel it, although a lot of you, I'm sure, do have gut pain. A lot of this inflammation is more silent because it's in a system that is not getting eyes on it all the time. It is important to have a distinction between hydration and swelling because we need to have some amount of water is healthy. Water can go 2 places. It can go inside of the cell or outside of the cell. Inside of the cell is where we want it because that's going to be good hydration. That's going to allow us to have an inflow and outflow of the electrolytes and nutrients that we need. Inappropriate swelling is going to be outside of the cell, and that's when you're going to see swollen ankles is the #1 place that you see it. A lot of people will get, swelling in their gut, bloating type feeling because you have unnecessary amount of water retention in your digestive tract type of thing. But the healthy requirements for like keeping water in the right places are a balanced blood sugar, blood flow regulation, exercise, and appropriate electrolyte intake. Like a lot of people will notice that the consumption of processed foods or excess grains or sugar will immediately lead to hand or foot swelling because this will make the swelling go in inappropriate areas that it's not supposed to go to, because a lot of times processed foods and sugar can block the influx and efflux of appropriate chemicals in and out of the cell. So just a quick note on proper hydration. We should be drinking like 3/4 of a gallon a day most of the time, like 100 to 120 ounces. More than that is not necessarily better because you can just like dilute your electrolytes too much and actually become dehydrated. Some people do have to replenish electrolytes, especially when they're eating healthy. Salt is a required nutrient. You do need 1,300 to 2,300 milligrams a day, honestly, sometimes more for athletics. Some athletes need more like 3,000 to 4,000 milligrams a day. But it's easy to miss this nutrient when we're eating clean because salt is naturally in a lot of processed foods, right? Like if you eat potato chips, but it is not in, if you're making steamed broccoli or if you're just eating like a plain steak, there's not automatically salt in that. You do have to add it. But salt does produce energy in the cell. So a lot of people will feel more energized just when they are replacing their electrolytes. So don't feel like you need to avoid all salt on this program. We just need to avoid processed foods. But just as an example, I had one patient who, ate super clean, but the only like bad food she ate was potato chips. And when she quit eating potato chips, she actually started like passing out and almost having like seizure-like symptoms because that was literally the only sodium she was getting per day. And like you do need some salt, not that you need to be eating potato chips, but just, put sea salt or something on your food. Yeah, I got ahead of myself already. We already went over this. There are good electrolyte supplements out there. There's LMNT, which we have. You could get the Redmond salts. Paleo Pro Hydrolite is good, or just like coconut water. A lot of these things will help, especially if you tend towards lower blood pressure. Too much sodium can cause high blood pressure, but honestly, not enough sodium will lead to low blood pressure. So increasing salt consumption for a lot of these people will really dramatically help them feel better and will actually increase blood flow to the gut, which will help with a lot of the conditions that we're going to be getting into today, like small intestine bacterial overgrowth is a big one where you need more blood flow to the gut, and actually increasing salt can help with that. That and hydration, including salt, can actually help keep things moving and prevent constipation as well. But back to inflammation for a second. So inflammation is a normal process in the body. Like I said, if you fall off your bike and scrape your elbow, you're going to want inflammation to happen, or otherwise you're never going to heal, right? So the stress on the system is falling off the bike. We get inflammation where we get the redness, the swelling. It's visible. We can see it on our skin. And then your body's able to usually detox, remodel, and come back into a healthy state where the skin looks normal again. Like I said, a lot of this is happening to our digestive tract. We just can't see it, so it tends to get ignored. But a lot of us get stuck in this chronic inflammatory state where it's like we're chronically scraping the inside of our intestines with like bad food choices, and it never gets this chance to come back to healing and homeostasis. And then things start getting into our bloodstream. They start to affect our liver. They start to increase that adrenaline, cortisol, histamine, those things like we said in the beginning, and then eventually, deteriorates our other processes like our hormone function. Inflammation of the gut and just the rest of the body, because like I said, after it gets into through the gut, then it starts to affect our other body systems. It is the root cause of most chronic diseases today, whether you're talking about, heart disease, cancer, diabetes, a lot of autoimmune diseases, arthritis type things are caused by chronic inflammation. So I like to put inflammation in different categories. So we have 5 different types. We have the food type, toxins, bugs, hormones, and trauma. And we're going to delineate what falls into each category. So the food component is a lot of what we're addressing during the first month of this program, because we're going to be eliminating these, right? So processed foods, foods that have a label of 20 different ingredients that are a lot of them man-made. A lot of man-made foods your body doesn't recognize as real food, so it actually has almost like an allergic reaction to it, where it creates that high histamine and inflammation. Trans fat is something that's in mostly fried foods, and a lot of like potato chips, and again, a lot of the processed foods. That is a very like bad fat for your bloodstream. It will clog things up. 3 is high fructose corn syrup. Again, another like man-made modified product, right, where we took sugar and made it more sugary. And so our hormones react more aggressively to this type of sugar than it would a normal sugar. A lot of the high fructose corn syrup is going to be in drinks, whether you're talking about juices or sodas. Even a lot of alcoholic beverages have the fructose added to them to make them sweeter. Alcohol is unfortunately always going to be like an enemy of progress, because it is technically a poison. When you drink, it takes about 4 days for your blood sugar to catch up, and it does like stay in your liver longer than you think. I mean, they say, oh, you can detox, a drink an hour to keep your blood alcohol level okay to drive. But that doesn't mean that it's still not bogging your liver down for multiple days in order to try to fully detox what's happened to it. It also will make you massively crave sugar, because it does deplete a lot of like your B vitamins and sugar stores in order to detoxify it. Hormones are another area of inflammation cause, and this can be from too much or too little of hormones, right? So if we have a lack of hormones, as in like a hypothyroid case, it can cause inflammation. We have added hormones, like this is a picture of cows' udders, right? So we have a lot of added hormones to dairy, where we can have too much estrogen. We have too much estrogen in our water. Stress hormones can definitely contribute to inflammation. Anybody that's going through trauma will usually have higher levels of pain and inflammation, for example, or even if you're going through a big life change. Sugar is going to be a big hormone disruptor where it can increase, uh, estrogen in males. It can increase testosterone in females and just lead to a total imbalance. And then we have hormone disruptors, which is going to be a big one that we get into the liver phase of this program, but things like BPA that can mimic a hormone in the body. So the body will say, oh, I have enough estrogen. I don't need to make any more. Or I have enough testosterone. I don't need to make any more. But really, it's because the BPA is blocking and making your body think that it has something that it doesn't have, the real thing. So bugs is another one that is going to be addressed in this first month. So we have yeast, mold, bacteria, parasites, viruses. All of these things are contributors to leaky gut. A lot of us saw how much inflammation can be caused by bugs when we went through COVID, because obviously COVID created so much inflammation that it actually was detrimental to a lot of people. And the spike proteins that were produced to try to help fight the virus actually produced enough inflammation that it gave people heart attacks and strokes, or just made it so that they couldn't survive. Um, COVID is not the only virus that can do this. There are other things that we get exposed to or that can be in our system long term that can cause a lot of inflammation and problems. Like I have people all the time that'll travel and they come back from traveling and they're like, my gut just hasn't been the same since I went to Mexico or something. Well, you probably caught something and you probably haven't got rid of it yet. But going through the leaky gut the first month of this program, a lot of times will help really boost the immune system in the gut in order to help destroy a lot of these bacteria and parasites naturally. Or sometimes we do have to add, extra herbal or even extra medical intervention to get rid of some of the more severe cases. Toxins is another one we're going to get into month 2, but it can be in your water, in your air, too much plastic, inappropriate household chemicals, too much hygiene products or fragrances that are full of toxicity. Trauma was another one that can cause inflammation. So this can be stress, posture, emotion, events, or injuries. Injury is going to be the most obvious, right? Like I said, if you fall off your bike, we're going to have inflammation. Extreme life event changes tends to produce almost like trauma chemicals in people's brains. Even honestly, good events, like people getting married or moving or something, it can be a positive experience, but still the increased stress hormones from those experiences can cause inflammation. The good thing to remember about a lot of this is your digestive tract is in charge about 70% of these hormones being produced. So if you have a healthier, more balanced gut, you will have less tragic reactions to some of these other things that might be out of your control. I consistently have people go through this program that are like, oh, I noticed I just don't get overwhelmed as easily, or I noticed I had a big life event and I didn't end up, in the bathroom for 3 days because of this life event. So changing the health of your gut can change how you react to some of these circumstances. But mental health is not something that I address. So if you do have something significant going on in any of these areas, I do always recommend that you obtain outside help to address some of these, because depending on how traumatic some of them are, it might be hindering your ability to get better. So the fastest way to influence inflammation is through the diet. Again, that's why it's month 1. There are a lot of things we have less control over, like I said, but we can control what goes in our mouth. So before we get into why each food is included or excluded in this program, we are just going to go over what leaky gut is. And then in the next lecture, we'll get into each and every food group that we are avoiding during this program. So there are a number of anti-inflammatory diets that are popular out there, but the core of most of them is going to be that they're mostly focused on fruits, vegetables, and meats, and less processed foods. All right, so leaky gut. 2,500 years ago, Hippocrates said all disease begins in the gut. And I think that we are still believing that that's the case, right? Even when you look at a virus, for example, like it gets into your mucus linings, like in your nose, and then guess what? It sounds gross, but you swallow that, and then it gets into your digestive tract and can affect other things. Like I said, most of your immune system is there. A lot of our brain chemicals are formed there. So there's just a lot of bodily processes that are dependent on the health of our digestive tract. So before we can identify what's wrong, we're going to say, like, what is normal digestion? So normal digestion, we have food and enzymes in our mouth when we chew. Okay, ideally we chew our food for more than 2 seconds, and then it goes into our stomach. Our stomach has hydrochloric acid. So this is a very, very strong acid that is meant to like break apart our food into smaller pieces so that we can digest it easier once it gets into the small intestine. HCl or hydrochloric acid is especially important for digesting meat, like digesting protein, because that's harder to break apart than a lot of our simpler foods like carbohydrates, right? Then once into the small intestine, we have enzymes from the pancreas and bile from the gallbladder that are going to come in and further help us break down our food. Then that food is supposed to be in tiny little pieces absorbed into our bloodstream and then sent where it needs to go. A lot of the digestive enzyme supplements are to help with this process, in case you're wondering why you're taking those during this program. So some common symptoms and what they mean as far as what part of your digestion is not working. So when you have a lot of gas, that is from bacteria feeding on undigested food in the small intestine. That means that the food did not get broken down properly. Cramping, pain, and spasms is usually the body is trying to eliminate bad food, or honestly just trying to eliminate poop sometimes if you're kind of backed up. Upper right abdominal pain is an indicator that your gallbladder is not emptying appropriately, so that you cannot digest your fattier foods as appropriately. Same thing, so pain after a fatty meal, again, is going to be the gallbladder is not functioning as well. A lot of that is going to be things that we get into in month 2. The enzymes will help, but sometimes we do have to get further into the liver health in order to get the gallbladder working properly. The gallbladder is just the storage sac for the liver. The liver is really what's doing most of the heavy lifting. And just to give an example of like one thing that really overwhelms the gallbladder is too much estrogen, and we're going to say AKA birth control. I've had a lot of females that have felt like their gallbladder is not working, and then they stop taking birth control, and all of a sudden, you know, all their upper right pain goes away. All of a sudden they can digest fat again. And that is because estrogen extremely overwhelms the liver when it's in excess, and then it makes the gallbladder not be able to empty properly and digest our fattier foods. Constipation can be from dehydration, inappropriate food reactions, or just bad movement of the muscles around our digestive tract, because exercise is one of the things that can help get things moving. So a lot of times just being stuck in a sedentary seated position for too long can actually back things up. Diarrhea is usually from the body trying to eliminate something. This will happen to people sometimes occasionally through this program, because if you get to a point where your body's ready to clean out a parasite, or your liver detox really kicks in and your gallbladder empties, it can cause temporary diarrhea in some people during this program. But chronic is obviously an issue. Heartburn is from not enough stomach acid or your stomach being in an improper position, which we will address both of those things in this chapter. So lesser known gut symptoms. So leaky gut or gut inflammation can cause headaches, shoulder pain, low back pain, excess thirst, fatigue, brain fog, allergies, bad breath, ringing in the ears, fibromyalgia, abdominal pain, dark circles under the eyes, flu-like symptoms, and acne. right? So we don't always have to have just constipation and diarrhea be the only thing that are linked to our gut health. A lot of these are very direct, very immediate, common symptoms when our gut is not functioning. Because yes, leaky gut affects the whole body. Most people, when their gut function gets better, they'll notice their thyroid works better, their skin is clearer, their brain is clearer, they have better sinus clarity, their joint pain tends to decrease, adrenals are better, and then the most obvious is that your colon functions better. A lot of diagnoses that are associated with having leaky gut, one, ileocecal valve syndrome, low stomach acid, infections, allergies, autoimmune conditions, small intestine bacterial overgrowth, hormone imbalance, brain fog, and liver dysfunction. So when we cannot absorb our food properly, it leads to widespread depletion of nutrients. We live in a time where calories are in excess, but people are actually nutrient deficient a lot of the times. And when we're nutrient deficient, it makes us hungry all the time and we eat too much. Our inability to break down the food leads to chemicals getting into our bloodstream that don't belong there. That makes us extremely inflamed. A lot of the supplements during this part of the program are based on anti-inflammatory. So turmeric, a lot of the vitamin D, the vitamin D has fish oil. All of those things are to help balance out the inflammation and the immune system during this phase. So this is what leaky gut kind of looks like. So normal is going to be the tight junctions on the left, as opposed to the right. When things get kind of separated, we can get things into the bloodstream that don't belong there. This is where the repair powder comes in. The repair powder is to try to seal up these junctions and bring down the inflammation in the gut lining so that we can have a nice tight barrier that protects us from things getting into our bloodstream. A lot of the causes for this are vast, right? So we can have hormone changes, stress, toxins, food allergies, blood sugar issues, infections, low digestive capacity. I mean, the list is vast. And the reality is that everybody has leaky gut at some point in their life. It's just supposed to heal itself, right? So like anytime that you got like food poisoning, for example, and you're sick for 24 hours, technically for probably 10 days after that infection, you have leaky gut until your digestive tract can heal. It takes 10 to 14 days for the digestive tract to heal. But that's going to be what we call like appropriate leaky gut, kind of like appropriate inflammation, right? Where it's like you have this incidence that happens and then your body gets better from it. The problem is a lot of us with our diet and lifestyle, the tight junctions never heal, it never gets better, and it just becomes chronic. And there are a lot of infections that last longer than 24 hours that can be lingering and causing this problem to perpetuate, or just chronic bad diet decisions can cause this to perpetuate. And sometimes it's not even a bad diet decision. It might be just something that you're allergic to or something you're reactive to, or genetically you just don't break down, that you're eating too much of without knowing. So why it's important, we've gone over this probably ad nauseum at this point, but 80% of your immune system is located in your gut. 70% of your brain hormones are formed there. It's a huge surface area that's there to protect you. It's supposed to block things from getting into your body that don't belong there. It's the main thing that is open to the outside world, right? Like unless you fall and have like a giant gash in your arm, your skin is there to protect most of the rest of your body. Where most things enter is through our digestive tract. So we really want it to be as fortified and as strong as possible. And then obviously we just want to be able to absorb our nutrients so that we can feel full, satisfied, energetic, and have long vitality. All right, so how do we fix leaky gut? So number one is anti-inflammatory diet, which you all have an extensive do eat and do not eat food list for that. But like I said, if you want to keep it simple, it's just going to be fruits, vegetables, meat, sweet potatoes, and coconut products. It's going to be like top 5 things you're going to be eating. Some people will have to address the infection. A lot of the supplements on this program are to help boost your immune system so that you can get rid of the infection on its own, but there are definitely extreme cases where maybe an antibiotic is required. Something that can be helpful is actually just to get adjusted or get acupuncture, just like some type of physical care that can actually influence like the speed of your digestion, because the speed of your digestion does open you up to susceptibility to leaky gut, especially if you have too much diarrhea or constipation, really. The supplements on this program between probiotics, L-glutamine, herbal support, digestive enzymes, HCl, all of these things are what you are taking supplement-wise to help heal your gut faster and to just like aid in the overall function and absorption of your nutrients. And then lastly is going to be increased blood flow to the gut. And that's where I really want people to stay hydrated, make sure you're eating your salt, and, you know, get your steps in every day so that you can get the blood flow to your stomach. So I a lot of times get the question, well, can't I just do the diet part and not do the supplements and then I'll get better? The answer is technically yes, it will probably just take a lot longer. But sometimes the inflammation is so aggressive that you need a fire hose to put it out. So here's an analogy for you. So if your house is on fire, so let's say like your house is your gut, right? The appropriate prescription for getting that better is water, right? So if you go at your house on fire with a squirt gun, you're probably not going to get very far, right? Whereas if you go to the house on fire with a fire hose, then you might actually have a chance of putting the fire out. And that's kind of the point of the supplements on this program. The supplements are to give you this fire hose approach to putting the fire out and decreasing the inflammation so that your body actually has a chance to heal. Whereas if you're only doing diet changes on its own, it can be exhausting because you're going to be doing it for a long time without seeing a lot of results. And, you know, you start taking a massive amount of liquid turmeric and you see results a lot faster. So the 4 R's to repairing leaky gut is 1, remove. So remove the inflammatory foods. 2, replace with healing foods. 3, repair with supplements. Like literally the name of the supplement is repair. And then 4, rebalance with probiotics, which you also have. We're not going to go over these lists today, but you guys should all have them so that you know how to do some grocery shopping to get your anti-inflammatory food list started. Like I said, if you need like a simple thing to think of when you're at the grocery store, keep it simple, stupid is 5 things. So your 5 things are meat, vegetables, fruit, coconut products, and sweet potatoes. A couple other things that you can do like non-dietarily to improve stomach function is chew your food. Try to, especially meat, you need to be chewing it at least 20 times before you swallow. Try not to do like scarf and barf type things. Try not to eat while you're at your desk, eat while you're driving. Those types of things can really be eating in a stressful environment. And when you eat in a stressful environment, you really don't produce enough stomach acid or digestive enzymes to produce your food. And it's the root cause of a lot of bloating is just speed eating. Try not to overly drink water with your meals, especially cold water, because that can dilute the enzymes that you actually need to break down your food, which again can lead to more bloating and indigestion. Try to eat in a calm environment. I mean, I really truly think that we are meant to like sit and eat at a table like with our family. I don't know how many patients I've had that have gone on vacation and they go, oh my gosh, I went on vacation and I lost weight, even though I was like eating and drinking and doing all the things I'm not supposed to do. And I'm like, well, you lost weight on vacation because you were actually digesting your food, because you were actually sitting down and enjoying your meal and enjoying the people around you and not scarf and barfing at your desk. So like eating in a calm environment, I really do think improves your absorption of your food and leads to less cravings, less bloating, and just better overall function. The stomach really responds well to heat. So having hotter food or drinking hot liquids can improve digestion. Um, if you feel like food's just not moving, literally just putting a heating pad on your upper digestive tract can help to digest food better, especially if you're having trouble with digesting protein. Uh, my Dr. Rachel rule is from the belly button up heat, from the belly button down cold. So if you're having trouble from the belly button up with bloating and indigestion, or just feeling like you have a brick in your stomach and it's not moving, then put a hot pad on. If you're having a lot of like bloating, gas, distension, pain in the lower abdomen, it does respond better to putting an ice pack on it. You can also do stomach massage on yourself. Like I have a picture in here or a picture in your packet of how to kind of grab from the lower rib cage and draw down towards your belly button. Doing this with like coconut oil or even sometimes like some CBD lotion can really help to get the food moving. And even some massage therapists, you could maybe convince to do this for you. I've used it many times, especially during pregnancy when there's literally something in the way, so you can't digest your food. Having somebody do the stomach massage or like a diaphragm release technique was really, really beneficial for me. Along the same lines of that, chiropractic and acupuncture can like dramatically improve function in this area. I know during all three of these things, I've taken advantage of, acupuncture, chiropractic, and massage. I've actively felt my stomach drop. I felt hiatal hernias like disappear. I've really felt like my digestion improved immediately. Like you go home after treatment and you're like, oh my gosh, I'm so hungry, because, your digestive tract is actually functioning 100% again. So keeping those therapies in mind to improve digestion is like very helpful. A couple other ones along the same lines of that is like learning to do diaphragm breathing. A lot of people, when they stressed, they tend to breathe with their shoulders, where they're going up and down, up and down, up and down. That can really like jam things up into the rib cage, especially food wise and digestive wise. So if you can try to breathe with your stomach, that will improve digestive function. So literally put your hands on your stomach, and when you breathe in, make sure that your stomach is actually coming up when you breathe in. So diaphragm breathing and strengthening your core. So when I say strengthen your core, I don't mean go do sit-ups, because actually going to do sit-ups and a lot of other laying down abdominal things will actually make your digestion worse, because it can jam things up into your rib cage. So one thing I really think is important is strengthening your glutes. So actually doing any leg exercise with a rubber band around your knees is very beneficial. That's honestly probably like the best thing for strengthening your core and bringing your stomach down, because glute strength is usually where people are lacking more so than the whole like just doing crunches thing. And then lastly, eat small meals. Don't eat late at night. Your digestive capacity is related to sunshine. So if we're eating in the dark, our digestive capacity is less. And then similar to the don't dilute your food with water is don't dilute your food with carbs. Eat protein first, especially if you have a hard time eating meat. I have patients that if they want to digest a steak, that's literally the only thing they will eat that meal, because it just requires so much HCl and so many digestive enzymes that it's easier to digest it if it's not diluted with a lot of other things. Eating like too much fruit or too much potatoes with meat can make it way harder to digest it. So try to either eat your protein first or eat your protein by itself. Will be a very beneficial thing to breaking down your food. A few other cheat sheet things to help with constipation if the previous page doesn't get rid of it. One is electrolytes, which is where you can add the salt packets in. We already went over like getting adjusted or acupuncture or massage, that type of thing. Some people will have to actually increase their healthy fat. A lot of people will go on a clean eating program and just like only eat chicken and rice and then wonder why they're constipated. It's like you do need to eat fat in order for your gallbladder to empty, and fat is like WD-40 for your intestines, so you do need some of it to keep things moving. Um, Castor oil packing or enemas is something that we're going to include in month 2 here. Those are going to be a little bit more aggressive as far as getting things moving, but if you're struggling with going multiple days without going to the bathroom, it's definitely something to investigate. If you're not good at eating vegetables, adding in greens powders, especially greens powders that have probiotics. Choline is another supplement. It is also something that is really high in beef and eggs, which kind of goes into my whole you need to eat fat to keep things moving argument. But choline is also very high in a lot of drinks, like as weird as this sounds, because I'm not like a proponent of energy drinks, but honestly, if you're severely constipated and things are not moving, there are a lot of energy drinks that are high in caffeine and choline, or a lot of pre-workouts that are really high in caffeine and choline, and that will really kind of empty things out if you're in a bad state. Aloe drinks can be helpful. Magnesium citrate is definitely a very strong laxative. And then the other thing is like get movement in, especially, like I said, the leg movements, like activating the glutes. If you go do a heavy leg day at the gym, chances are you're going to get things moving. So make sure that the muscles are functioning. This, like I said, the hot cold therapy, this is what we already went over. So the reason that the cold therapy works the best on the lower intestine is a lot of times because of this called your ileocecal valve. It is a valve on the lower right side of your abdomen. It is right next to that squiggly thing that is your appendix. So it does get mistaken for a lot of appendix pain. So if you've ever had severe right lower abdominal pain and they said it wasn't your appendix, it was probably your ileocecal valve. So this is the gateway between your small and large intestine. It's a very small opening. It can get inflamed, especially from a lot of like roughage or a lot of undigested food or a lot of bloating can really rough it up. Ice helps it calm down, just like, if you sprain your ankle and you have a lot of, swelling on an injury, it brings the inflammation down. Same thing with your ileocecal valve. Cold therapy really, really helps. Ileocecal valve is kind of the reason that I got into doing this type of work. I went to the hospital more than once growing up thinking that I was having an appendix attack and, went through all the testing and they never found anything. At one point they blamed it on my ovaries. And then finally, one of my OBGYNs said, oh, well, maybe it's your intestine. I think it's your intestine. But then they never could really tell me like, okay, but what do I do about it? I finally found my chiropractor in St. Louis, Missouri that addressed this with me and taught me, okay, like these are the foods that tend to aggravate it. This is how you avoid it in the future. And then he gave me specific adjustments that really helped to keep it under control. And I can say I've not had one of these weird attacks since I started care with him and learned how to avoid having problems with this in the future. So the biggest trigger for this is going to be nuts and seeds. So one of the times that I had an ileocecal valve attack was the first time I went paleo and I just started eating almond everything. So don't go too buck wild on nuts for sure, because it's one of the reasons that they're not included in the first months of this program is because they're such a huge trigger for that valve. But nuts and seeds are a hugely non-absorbable fiber, which is like sandpaper going through the intestines, especially to that tiny little valve. When a plant creates, nuts and seeds, that's their little babies, that's their little plant babies that they're trying to get planted somewhere else. So they really don't want you to be able to digest it. They want you to eat it in a nice succulent piece of fruit, and then they want you to poop it out somewhere else intact so that it can grow into a new plant. They doesn't want to be digested. So they produce a lot of chemicals and a really hard outer shell to try to make it through your intestinal tract. So the funny thing is we all think that it's a healthy food, but really it's the plant is producing toxins to try to get it not to be absorbed. So you have to be really careful with overdoing it on the nuts and seeds. Other foods that are offensive to the ileocecal valve is really just going to be most of the junk food that we're avoiding on this program, because these are things that produce, the bloating or the sandpaper-like uh, phenomenon going through your intestine, causing inflammation. And then our next chapter, we're going to go over each food that causes inflammation and why. So stay tuned.